So today is day zero. I had my surgery today and it went well, I think. I am very happy about it. Uh, Actually, for right now, it hurts less than I expected. It's not as much swollen. So let's see how my knee looks now. Uh, so, as you can see, I'm very careful. I'm using a walker. So step up with the good foot, with the good leg, and lift. And this is all I have. Just one big band-aid. I expected my knee to be big with bandages and stuff, but no, just one bandage. There are stitches under it. Obviously, there's little blood seeping through. The right leg is a little bit swollen, but other than that, uh, it looks really good. A little orange, I think, from the disinfection, but that's all good. Okay, so let's talk a little bit more about what's going on, or what was going on. Whoops. Okay, so as you can see, I'm using walker for anything I do. I don't put full weight on my leg. When I forget and put a little more weight than I should, my knee actually buckles. So the walker is awesome. I didn't want it at first, but I'm very happy that I have it. Okay, so what I wanted to talk about, surgery went well. What did they actually do? They gave me a spine injection. So anesthesia was into the spine, and then I got also a nerve blocker. So they put some local anesthetic somewhere here in my leg that numbs the nerve, and it numbs the nerve for, they said, 16 hours or so, or 16 to 18, I think. So I should expect tomorrow between 2 a.m. and 6 a.m. to be in lots of pain, which is not good, but hopefully it's not gonna be that bad. Uh, so the surgery I got is knee resurfacing, and to the insurance, it's the same as total knee replacement. So I'm hoping the knee resurfacing is better. There is no glue. Everything kind of should bond to the bone, and uh, I just got essentially two titanium plates in my knee instead of the previous cartilage, and so I'm hoping that everything will bond the, to the natural bone, and it will last a lifetime. Hopefully, a lifetime. That I will need another one of these. Uh, so the advice that I got from doctor was to keep the leg straight at least for a few days. So keep the leg straight as much as possible. Do this, leg activation exercises, but do not bend the knee to 90 degrees. So anytime I get up, let me show you from the side, and I cannot quite lift my leg on my own, so I'm helping with my hands. So anytime I need to get up, I straighten the leg that was operated on, and bring the walker close, and use my arms and use my leg. Actually, in this case, it's actually better to push off the seat here. So I push off with my arms left on my good leg, move my arms here, and straighten up. And now I'm in a position that I can walk. Always put the bad foot first, lean on the walker, and the good foot. Move the walker, move the bad leg or operated leg, add the good leg. So going backwards is the other way. Good leg first, bad leg follows. Okay, and again, when you're sitting down, just think about keeping your leg straight. Uh, As far as the level of pain, I'm just taking a little bit of Tylenol and a little bit of ibuprofen, and the pain is manageable right after the surgery. And I think it's because all the numbing medication that I got. I am expecting much worse tomorrow, and hoping for expecting the worst, hoping for the best. So I'm expecting much worse, but I'm also hoping that I will not need to use the oxycodone or whatever narcotic they prescribed. Uh, okay, so we talked about standing up and sitting down. Let's do it one more time. So always when you're sitting, keep your leg almost straight, and when you want to stand up, bring your walker closer, push with your hands. All the weight is on my good leg, and straight up. Actually, I can do it from this view as well. So all the weight is on this leg. I'm sitting down, helping with my hands. If you have a chair with some armrest, that's even easier. I am pushing off the sofa, but if I had the armrest here, it would be better. So if I do it here on the side, at least I have it on one side. So let me scoot over a little bit. So I can push here on the armrest and here, and that's really easy. Okay, so now when you sit down, that's all good, but how do you get your leg up? So for that, pretty much anything will work. I'm using a belt, just a belt, and I mean, you could see me using my arms here, but that's actually painful. So if you want to put your legs, say you want to get into bed, the good thing is take your belt. So you cannot see. Okay, here. So take your belt and hook it under your foot, and now pull with your arms. And this really doesn't require any muscle strength, any leg muscle strength. I'm just pulling with my arm, keeping my foot fairly relaxed, and then I can move it here. I can move it to the other side, and then add the other leg. And if I need to go to the other side, first put my good leg up. Again, have the belt under my foot, and notice with the belt it's really easy to hook. Like if you have some kind of rope, it might be more difficult. So the belt is actually pretty good. And then lift my leg, and I'm in bed or on the sofa. Okay, so, and keeping my legs straight. So let's do a few things. So actually, right after the surgery, my knee was not that swollen. Or my knee, this all upper, the thigh muscles were not that swollen. Now they are. So the first thing, you gotta keep the swelling down. I haven't iced yet, but I have already laid down for like 45 minutes with my legs elevated, and so let me get help with the belt, because I need to lift my leg high. Shoot. Okay, not that easy. So you can get somebody to help you to shift your position a little bit, or put pillow under your leg. I'm just doing it with the armchair. So get your leg up and put your heart below your foot. Actually, it would be better to have it a little bit higher. So on my other sofa, I have a pillow on top of the armrest. And notice that I have my leg, the knee is not supported. You can go probably either way, but if you support it lightly. But this is actually good for trying to keep the leg straight, and I'm very happy I can straighten the leg as much as I could before the surgery. So I want to keep it this way. It's still, the other leg is lower, so I need to work on those few extra inches, but this looks already good, so I'm very happy. And as we discussed yesterday, the most important exercise after the surgery is leg pumps. And I keep doing them pretty much any time I can remember. I just do leg pumps. I do them, you know, in an elevated position. Oh, sorry, ankle pumps. So you can do both of them together, alternate. Uh, they told me to do about 20 each time I do them. They said 20 each hour, but honestly, I do them anytime I remember. So, you know, every 15, 20 minutes, I'm like, oh, ankle pumps. Okay, let's do them. So it's all good. As far as after the surgery, I actually felt pretty good, and but as soon as I got home, I got really tired, and so I took a nap, which was awesome, and then I had dinner, and after dinner I felt really lightheaded and almost dizzy. And this is to be expected, at least that's what my, you know, discharge instructions say. So don't be too concerned. I just went, lay down, elevated my legs, and now I'm fine. So that's that. I'm allowed to take showers, but since I took one shower last night with the a special soap, disinfecting soap, and I took another good shower this morning, I'll probably pass this night and just keep the area clean and dry, and take shower tomorrow. Uh, yeah. So we talked about the ankle pumps. Do them as much or as often as you can. I think they are really good. They prevent the blood clots, and when you get blood clots, it can be pretty dangerous. So that's really the most important thing. Exercising the ankle and making the blood flow all the way in your leg, up and down. Okay. The other thing, of course, elevating. And optionally, if you feel up to it, which I do a little bit, when you have your legs straight, try to just activate these thigh muscles. I don't know if you can tell, but I'm actually activating the muscle, and it's not bad. I can activate, there is no way I can lift the leg up on my own yet, or even like if I support here, I cannot really lift the ankle up, but I can activate and try just a little bit. And of course, I cannot lift the whole leg up yet, but just giving the muscles a squeeze, I think, is a really good thing. And hopefully tomorrow, I will be able to do a little more. Also, the pain so far, my knee doesn't hurt at all, my calf doesn't hurt at all, but my thigh hurts, and especially this area here, right here. So my thigh hurts. I think it's from, nobody told me, but I think it's from when they stretch the knee, they open and do the work there. This muscle gets really stretched. So I'm hoping that the pain will get less and less. Maybe tomorrow is going to be the worst day, and then after that, less and less. But other than that, everything, like, I think everything went better than I expected, honestly. So, oops. So that's a good start to my recovery, and yeah. So wish me luck. I have really big plans I don't think I can ski this season yet, but I am hoping that I can bicycle as soon as the weather gets nice. So in about 2-3 months, I should be able to go for at least easy bike rides. And if I can, they will make you really happy. All right, talk to you tomorrow. One more. Okay.